My name is Erin Massey. I'm a licensed clinical social worker, and I'm a behavioral health consultant at Orfino, Idaho, in a primary care clinic, and we're doing integrated behavioral health. My approach is unique because I'm part of the primary care team. So when a primary care provider identifies that someone could benefit from meeting with me to work on behavioral health concerns, that's when I come in. So it's a little different. So traditional therapy, you think of going to a long-term therapy clinic and in an outpatient setting, seeing someone for like hour-long visits. So with me, it's a little different. Sometimes I meet people in the exam room when the provider has been in there with them, and the provider feels that maybe, they could benefit from meeting with me. So there's been times when somebody's had a diagnosis of diabetes, like maybe a new diagnosis, and they need assistance in identifying ways that they can try to control their blood sugars better, things like that. So, and then there's also the aspect of maybe they've got anxiety or depression, and somehow that plays a role into having their diabetes not be where they want it, where their numbers or their A1C where they want it. So it's a little bit, it took me some getting used to actually to do this, because I came from the outpatient long-term therapy clinic. And so kind of trying to squeeze it down into a shorter visit took some time to learn, but I do think that it's pretty beneficial because sometimes people just don't have the time for that. So, and working in the same setting as their primary care physician, it really makes it easier for them to access those services. It's increased significantly. I've seen my patient numbers go up because not only are they dealing with, personal health issues, but they're also dealing with, what's going on worldwide, or what's going on locally in regards to COVID. And, I started doing telehealth during COVID. I'd never done telehealth before, and now it's a regular thing for me. So, I talk to people on the phone all the time, or telemedicine, through like a Zoom platform. But I think that since COVID, access to resources, we've realized that we need to kind of get creative in rural areas. And so I think that by having those types of things, it's made it more accessible, and I've been able to see more people. We're really trying to, with it being a rural area, I think we're really trying to break the stigma of mental health and help people understand that, mental or behavioral health can affect physical health as well. So trying to help people make that connection in our community, because it's been, like other places, it's kind of taboo to talk about, if you've got depression or you've thought about suicide, things like that. So I think that, on top of the stress of having a chronic disease, if you're having mental health issues as well, it's just like you go to if you have a broken leg, you go to the doctor to get it figured out. It's just like with mental health, you've got to go get help. So I think we're really trying to change the look of change how it looks in our community with mental health, and make it more of a common understanding, along with, taking care of your medical needs as well.